So, the time has come for cranial nerve 12, the hypoglossal nerve. And the hypoglossal nerve is all about your tongue. That's right. The hypoglossal nerve is a pure motor nerve controlling all the intrinsic muscles, meaning the muscles that control the shape of the tongue, and the extrinsic muscles, which are the muscles that connect the tongue to other tissue and other parts inside of the mouth and control the movement. So I'm gonna take a look at your tongue in just a bit. You don't have to stay it out just yet. But the hypoglossal nerve, the cranial nerve 12, it arises deep within the brainstem, like the vagus nerve, the accessory nerve, and the glossopharyngeal nerve in the medulla oblongata. From there, it travels down the brainstem through a hole in the skull called the hypoglossal canal. So it has that canal all for itself, the hypoglossal nerve does. It then travels down right in between the carotid artery and the internal jugular vein before coming to the tongue, where it really works its magic. And here inside of the tongue, it innervates quite a few muscles. Like I said, the external muscles called the genioglossus, styloglossus, hyoglossus, and the intrinsic muscles, the superior longitudinal lingual, the inferior longitudinal lingual, the transverse, and the vertical muscles. So these are all the primary muscles of the tongue. There's also something called the palatoglossus, but that's innervated by the vagus nerve. So that's, well, strictly not relevant. It's kind of hard to distinguish and separate all of the different parts of the body of the tongue in this instance. And that's why we're going through all of the cranial nerves so slowly and so methodically to separate out all possible symptoms and problems that we may find. So hypoglossus is actually Greek for under the tongue, which is quite fitting for a cranial nerve that strictly focuses on the tongue. But being that it has such a strict focus, damage to the hypoglossal nerve can also cause quite a few problems and difficulties with the tongue. If you have, trouble moving it around, it's called dysarthria. So maybe you have trouble moving it around inside of the mouth, sticking it out straight. We can sometimes see that, and if you try to stick it out straight and it deviates to one side, that does indicate damage to that side of the nerve. As we've talked about, all the nerves are paired, so always symmetrical inside of the body, always two sides to every nerve, not just to every coin. You can also experience muscle fasciculations or twitching in the tongue, or in general problems chewing or swallowing. Of course, those symptoms can also be attributed to the glossopharyngeal and the vagus nerve, even the accessory nerve to some extent. But we've already went over those. But can I just ask you quickly, have you experienced any trouble with your tongue in general? Any of the symptoms I just described that ring a bell to you? Okay. That's good. Nothing of the sort that you can think of right now. Well, I guess that's enough talk for me. I can imagine that you just want to get on with it and get out of here, really. So there's just very few, very simple tests for the hypoglossal nerve that we'll be doing. So I'm just going to put closer to you and can ask you to open your mouth. I know I've taken a look at your mouth before, but just in general, okay? And stick out your tongue for me, just nice and centered if you can. That's great. I see no deviation to either side. Okay, can you move it this way here? That's great. And the other way there. Okay. Can you make it nice and wide? Can you make it skinny and tall? Okay. Okay, now as far out as you can and point the tip if you can. Okay, and now back inside your mouth. Just lay it flat like you would. Don't think about how to position it. Yes, just like that. Okay, now I'm going to be touching your cheeks. Is that alright? Okay, so close your mouth again and stick your tongue out and touch the inside of your left cheek here. That's good. Okay, now do the same with the right cheek here. Okay. No. Yeah, that was great. Okay, so nothing seems to be awry on the face of it there. So this is the last thing that we'll do today. I'm just going to ask you to make a series of clicking noises first. Let's just do a plain alveolar click, like a horse trotting. Like that. Okay? Yeah, you can start. Get about a dental click if you close your teeth. Okay, so that's done by tapping the tongue, and you couldn't. Doesn't sound quite right if you try it like this. Okay, that's done by closing your teeth, opening your mouth slightly. Just. Okay, that's actually just a tiny bit troubling and a bit unusual. Can you do a bilabial click? That's sounds like a kissing sound. Mwah. 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 Purse your lips. Mwah. Okay. No, that doesn't sound quite right. Can you whistle? Never learned how to whistle. Okay. Can you maybe do a trill for me? Like the Spanish R sound where you sort of flutter your tongue up against the roof of your mouth. Like a cat purring, perhaps. Like that. Can you make that sound? High or low? Okay. Can you do any sort of fluttering at all? It's like a trill, but just slower. Okay. Okay. Okay, so a few more questions. That's quite unusual. Have you had a stroke in the past month or even before that? No. Okay, I should think that you'd mention that by now if you had, so that's good. Okay, we know you suffered the trauma to your head. Are you taking your vitamins? Or have you had your vitamin levels checked recently? You have, and they're all fine. They did that. Okay, the nurses did that before the test. That's good. Okay, so because potassium levels, especially and calcium levels, can affect tongue movement, but can't be attributed to any of that then. And you haven't had any oral surgery, jaw, tongue, cavity, dental work even that we haven't noted in your file. You haven't. Okay. And you haven't had any serious infections in the recent past? No. Just head trauma. Okay. Well, I'm asking you this because, well, trouble with the tongue doesn't have to be neural damage, nerve damage. It can be, doesn't have to be. Okay. So nerve damage is the most serious kind, and it can be quite hard to treat in certain cases. But if it was an infection, for example, we would expect to see problems like this go away with the time. But nerve damage can be quite a different beast. But don't worry, even if it is nerve damage, it can also go away naturally over time. The lack of clicking and fluttering of the tongue, I think I could refer you to a hypoglossal physiotherapist, one who specializes in tongue movement. Normally they deal more with speech therapy, swallowing therapy, helping stimulate those muscles, because those types of damages are more common. Okay, but they could also help you get those detailed movements of the tongue back again. Yeah. Could you ever be an ASMR artist if you can't do a click? I'm afraid I can't. I don't know. I mean, maybe. I know a lot of people do that. You've always wanted. Okay. Look, I don't think that nerve damage should stand in the way of your dreams. So if you want to do that and you can't click your tongue, I think that's fine. I think you can still pursue that if you want. Okay? Yeah. No. Look, listen. That should be the least of your worries right now, if you can be an ASMR artist or not. Okay? Don't worry about that right now. What I'm gonna do is I'm gonna write you a referral to a hypoglossal physiotherapist. Same clinic, so you just make an appointment there and you can, and it'll be done the same place as you, okay? Yeah, so let me just make a note of that. Do that later. No, there is no waiting list, so I expect you can get an appointment in a day or two, or whenever it suits you, okay? Yeah. You aren't taking any medications that we haven't already talked about, right? Okay. No, I didn't think so. Okay. Could you just open your mouth again? Okay, and try to lift your tongue up to the roof of your mouth. Okay, you can do that fine. I was just wondering if it could be ankylosing. Say shorten the lingual foramen, that's the tissue connecting the tongue to the base of the mouth, the floor of the mouth. That can sometimes cause trouble with movement dysarthria, but it seems that movement was not a problem for you, so it can't be that. It's quite a bit on the mind. It's really quite an interesting case, generally. Okay, so that's the cranial nerve exam, all done, the hypoglossal nerve exam. Yeah, there were some slight issues there, but really, I don't think you should worry about it right now. There's no use in catastrophizing over the fact that you cannot click or flutter your tongue. Okay, all the other tests were fine. I can hear and experience that you have no trouble speaking, swallowing, or nothing obstructing your airways or anything like that. Okay, so day to day you should be fine, and you are fine. I mean, you went all this time since the trauma without even noticing this symptom. So it won't bother you in your day-to-day life, but if you are determined to regain this ability, I'm sure the physiotherapist can help you with that, okay? Yeah, so really, do not worry about it. Sincerely, I mean that. Don't worry about it, okay? Okay. So we will see you in a couple of days. Yeah, and they'll take a closer look at your tongue by then. Okay? Okay, good. And again, don't worry about it, okay? You're fine.